Shalom, good evening, good morning, good afternoon. We are global in Colorado with our guest, and Rose is in Australia, Melbourne. This is TMS Roundtable. My name is Dr. Tova Goldfein, and I love Monday nights because I get to hang out with Rose from Melbourne. Mwah! Rose, take it from here.
Good morning and good evening, everyone. Thank you for watching. Now, this week we've got Patricia Coughlin. She is an educator, and I just personally, if I can say, that when I first saw Patricia's work, I just knew that I had to learn this therapy. I knew about it, but I needed to know it so that I could practice it with people and change the dynamic of how I interacted with people and how I interacted with patients. So, Patricia, thank you for that. My other comment is that she has come down to Australia so many times and educated psychologists and psychiatrists down here in Melbourne. So I'm, if there was a devotee of Sarno, I'm a devotee of Coughlin. Because she has been an absolute inspiration. Pardon?
What was it, Rose? Can you say what it was about the work that really spoke to you, where you said, I have to learn this?
Basically, what are your feelings about that? Nobody asks that question. Nobody, do they?
So
in
true.
Ordinary language. Nobody ever says, what are your feelings about that? And I think that, and the first time I saw that video of a lady she'd driven across America to you, I think there was a 4-hour session, something like that.
Yes.
And she changed in front of the camera. And it was so beautiful to see. And now over all the years now that I've been doing it, I'm so grateful when I see it for patients myself now. I'm not an expert, but I know that I can help people's lives be transformed. And it's awesome as an old lady to be able to do this. And
You're not old. I will not let you say that.
Okay, well, I'm quite happy to be an old lady. So, in saying that, Patricia, share with us a little bit about your biography first, and also you were with Davanloo in those earlier years, and you know the connection between Davanloo and Sarno, and it's not really spoken about. But with Sarno's work, he always had Patricia Feinblatt there, who's an ISTDP
Arlene Feinblatt.
Arlene. Yeah. So there's a huge connection, and yet people don't know about it. So could you share a little bit about that?
Sure.
And then
I can only tell you what I've heard. Yeah.
That's right. Yeah. And also the fact that lives can be transformed, that people's pain and suffering can actually, that it's a messenger from their emotional lives. So if you can talk a little bit about that as well, that would be really great. And I think that's what our audience needs. We also have many psychologists that join us as well, like Johannes and etc. So just be aware that you're also talking to many of your students and colleagues and that as well. So thank you, Patricia. Thank you for coming on.
Oh, sure. It's my pleasure. Now, those were lots of questions. So, I'll start with what I remember, and then we'll just have a conversation. So,
Fantastic.
I'm somebody who, this is just the way I'm built or what I was born for or whatever, but I've just always been so interested in what's going on with people, beneath the surface. And so it was no surprise to me that I would become a psychologist. And I got really fabulous training in graduate school and my residency and so on, which was quite what we would consider traditional psychoanalytic, psychodynamic. So what that means for people who might not be familiar is that it's really understanding the unconscious mind and how powerful the unconscious emotional brain is. That our rational mind, what we tell ourselves, our stories, our rationalizations, are just the thinnest layer on top of, right, all the emotions and impulses that are really driving the bus. And so, so this theory of the unconscious mind was always very appealing to me. And yet the actual practice, the psychoanalytic practice, was not very effective. I mean, even Freud said that at the end of his life. He said, this was a good research tool. I discovered the unconscious, but you guys have to figure out
How to use it. Yeah.
You know, they just kept going back to what he was doing. Anyway, and interestingly enough, in the early days, Freud was a very active therapist, and he was quite challenging. And so Davanloo, who then I met probably 10 years into my professional life, actually was practicing a lot like Freud in his earlier days. But when I met Davanloo, like you, Rose, I saw his work on videotape, and, you know, my jaw was hanging open, and I just said, okay, here is where theory meets practice. Now I can see in front of my eyes the unconscious open in the most unmistakable way, and for the patient to make their own connections, right? It wasn't the therapist from on high making the profound interpretation. The patient would suddenly see what was really going on at a deeper level, and they could make sense of themselves and what had been driving them. So just like you, I said, well, I've got to learn this. So luckily, I was accepted into training with Dr. Davanloo, and I trained with him in the late 80s and early 90s. And at least from my perspective, I feel like it was an ideal time, that he really was kind of at his peak at that point. And I learned an enormous amount from him about how to make use, right, of our understanding of unconscious processes. And from what I understand, so he was first brought to the US by a group of psychiatrists in New York City at Beth Israel. And in fact, they even got a New York
You mean
Times.
he was brought? I mean, like he was asked to come?
Right.
He was not. He was in Iran. He was in Canada or Iran?
Canada.
Okay.
So he is Iranian, started out training as a surgeon, came to the US to do a residency. And in those days, like in the 50s and 60s, the best and the brightest went into psychiatry still, because psychoanalysis was the thing. So he shifted to psychiatry and trained in Boston and went to the Boston Psychoanalytic Institute, which was probably the most conservative of all the institutes. And he talks about his own experience in analysis having a dramatic impact on him, because he, you know, would lie on the couch and free associate like he was supposed to do. And he noticed that his analyst had the habit of picking up the phone during his sessions when the phone rang. And he was getting increasingly irritated about this. And then one day, when he was in the middle of some great fantasy or something, the phone rang, and the analyst, who would usually say later, or I'm in session or something, this time he actually engaged in a conversation. Well, Davanloo said his rage toward the guy just went through the roof. And yet he said, but what did I do in face of my rage? I am not going to talk to him. So I remained silent for the next 20 minutes, and he remained silent also. And at the end, he said, tomorrow. And he said, I walked out of that office and I thought, what a waste of time. I mean, my rage was right there. All he had to do was ask me about it, right? Not how do you feel about that, Rose, but how do you feel toward me, right? That I took a phone call in the middle of your session, right? So this was one of the things that really got him started. But then he was really working a lot on his own up in Montreal at Montreal General. And I don't quite know how. I think it was Manuel Trujillo, who was a psychiatrist in New York City, somehow found out about him or went up there and saw him and said, hey, you need to come to New York, right, and do some seminars so that people become aware. I think it was probably because in the late 70s, there were two huge conferences in Los Angeles with who we call the big four in short-term dynamic psychotherapy: Mann, Mallon, Sifnios, and Davanloo. And they were all showing their work. And so that's where he sort of came out, right? He'd been doing work on his own, videotaping everything, studying. If something worked with one patient, he'd systematically try that intervention with the next 10 patients and see what happened, right? And he would watch all the tapes and watch their responses. So it really was a scientific endeavor, right? He had a hypothesis.
It was.
It out, he would tweak as he went and so on.
Was this very unique at the time to be
Totally.
videotaping?
Totally. I mean, nobody was doing that. Except I think some family therapy people, but especially in psychoanalysis, right? Supposedly to preserve the confidentiality of the patient, but we know that really it's our ass we're covering. And that, in my experience, it's therapists who resist taping, not patients. And somebody said it was even a patient of Davanloo's who actually gave him an old reel-to-reel. I don't know if that's true. But anyway.
Well, even that technology was new in those days anyway.
Right. And that was a big old, no cams, no camcorders. This was the old-fashioned reel-to-reel. So eventually he went to New York City in the early 80s. And from what I understand, Sarno went to one of these seminars, one of these workshops, saw Davanloo's work, and just had a big aha himself. And started just asking patients, well, when did that pain start? What was happening in your life at that time? Oh, your husband left for your best friend? Wow. What feelings do you have about that? I mean, so, and he was really surprised by, and I'll tell you, when I was at the University of New Mexico School of Medicine about 10 years ago, I was in the headache clinic with the head of that clinic. And so she was a neurologist, and she would go in and she'd say, oh, this is Dr. Coughlin, this is my colleague. And she would be doing the neurological exams. And then while she's doing that, I'm sort of flying under the radar and just asking people, because she was like the person to go to in the whole state for migraine headaches. And I'll never forget the very first patient. I said, well, when did you start having these migraines? And she said, well, it was the funniest thing. Because, my father used to have migraines, and I never had them until he died. I said, oh, how did he die? Oh, well, it was terrible. It was a drug overdose and everything. And then, wouldn't you know, I start getting the migraines. And I said, oh, that's really interesting. Yeah. And then she said, and then it got even worse 4 years ago. Well, what happened 4 years ago? My brother was murdered. But she's saying all of this like it's, the weather report. And so, again, clearly she had, and no one had ever asked her. I mean, in all the years she had been going to see doctors, no one asked the simplest question. When did it start? What was happening in your life at that time? Right? And so I'm telling you, in 10 minutes, she was like, oh my gosh, right? I wonder if this has something to do with that, right? So again, Sarno just picked that stuff up and went and ran with it.
I really wonder if that was maybe, we don't really know. Maybe we could ask Michael Galinsky or find out like what actually, like we thought it was because Sarno was seeing, so many x-rays and some people felt better and some people didn't. And the x-rays were the same. So but something affected him. It could have been this.
Well, that's what I've heard. Again, I didn't ask Davanloo about it. I don't know Sarno. So it's all, rumor, whatever. I think it's very conceivable, right, that he did, because, as I was going to say earlier, someone invited a New York Times reporter to actually come and watch Davanloo interviewing patients. They did a huge story on him in the Sunday New York Times Magazine, which is about as big as you can get. And so that just put him on the map. But it was so overwhelming, the number of people from all over the world who started calling him for help, which he couldn't possibly meet, that he said, I'll never do that again, to make a public thing like that. But again, so certainly everybody in New York knew about him at that point. So I think it's very conceivable that this story is true, right? That Sarno went to see him, and this was maybe that missing link, and he started to ask people about it. Now, the one issue that's very different between Sarno and Davanloo, and Howard Schubner may have talked to you about this. Sarno understood that pain is very often the result of a chronic suppression, right, of emotional pain and rage, right, that we tense up, keep all those feelings down, and as a result, get pain. And the pain is very real, right? It's this muscle tension, right, from holding everything in. That was his understanding. He either had no understanding of, or I think actually would deny that guilt about those feelings was involved. And Davanloo came to believe that, and in my own experience, I'd say it's like 50-50. About 50% of the time, the pain is really the result of this chronic repression, and that once folks are encouraged to connect with and express, their pain and anger and everything, the symptoms vanish. But in the other half, if anything, there is a backlash, and the person has a mechanism in which they punish themselves for daring, right, to even feel or express anger. And so this is a big difference between Davanloo's model and Sarno's model, is the addition of the understanding about the guilt, that the unconscious guilt that people carry with them about their own reactive rage toward people in their lives who have hurt them, disappointed them, and so on. So I don't know if Howard Schubner told you this story, but when he came to me for supervision years ago, and he was trained by Sarno, so he thought it was just suppression of feeling. All you have to do is help the person express those feelings and everything will be fine. So this woman comes to see him, and she was having chronic pelvic pain. And so he started to ask her, well, when did that start? And what was that associated with? And it was associated with this particular relationship with this fellow. And he asked for a recent example of when the pain flared up. And she said, oh, yeah, that was last weekend. What was going on there? And she said, well, he was like tying me up, to have sex with me. And Howard, who is the sweetest man on earth.
Yes.
Sort of a Boy Scout, he was like, what? That's terrible. I mean, how dare he? You must be really angry. And she says, oh, no, I mean, I'm the one who asked him to do that. Right, I can only have pleasure if I'm being punished. Then he says, okay, I'm out of my depth here. You better go see somebody else. So again, that does, it speaks to, his humility, right? And all of us to know, who we can treat, who we can't. But that's where he really came to realize, oh, in a certain segment of the population, there is a heavy need, albeit driven unconsciously, to suffer, to be punished, to engage others, to use and abuse them. And these are the folks who tend to need probably some, one-on-one therapeutic work, right? It's not going to be as easy for them just to work this out themselves. But so that's my only understanding of, how Sarno came to know about Davanloo's work, some of the similarities between them and some of the differences. Yeah.
Beautiful.
Yeah.
Great explanation.
That explanation, that way of, that in-depth wouldn't have been spoken about in a seminar like that, would it, anyway? Because, I mean, that's much more in-depth. than just a general talk about feelings and pain.
I'm not sure what you're asking.
No, I'm just commenting that it's not something that Davanloo would have been speaking about at that stage when he was being interviewed by the New York Times. That's all.
I don't know. I mean, I think he probably, I don't know.
Well.
I think it is something, and again, maybe we all, or many of us, have a similar trajectory, right? Where we start with, in a sense, the simpler explanation. And as we start to work with patients, right? And some people, that's enough and they heal, and then others, oh, it's getting much more complicated, right? And then you start to see, oh, there are lots of factors involved here. It's not just the result of one thing. So I think that happens to all of us over time. Yeah.
Would you talk to us a little bit more about the patient in New Mexico, wasn't it, with the headaches? Because this is the sort of work that our patients, or should I say our viewers,
yes,
they haven't made that connection. They know about it, but it hasn't actually sunk in. So explore that a little bit deeper for the audience so that they can sort of see that the dad with the constant headaches, and then they take on board the headaches at his death.
Okay, so one of the things that I would encourage everyone to adopt is a very curious mind. And I'm always wondering why. So why would that happen, right? Why would someone start to have headaches when their father, who had suffered from headaches, right, dies in a sudden and traumatic fashion, right? And what function, right, does that headache serve, right? So it would have something to do, obviously, with his death. Because if it was just about the mixed feelings toward the father, they always had those feelings, right? They were 40 when their father died. They didn't have headaches. Why would they suddenly have headaches once the father died, right? So we would consider this some form of what we would call pathological mourning. And Eric Lindman, who way predates both Davanloo and Sarno, was a psychiatrist who studied psychosomatic disorders, ulcerative colitis being one of them. And what he found in his research was that 85 to 90% of the time, the first flare-up of ulcerative colitis or Crohn's disease, right, happened following a sudden loss. Wow. And so what he found was that the physical replaced, in a sense, the emotional upheaval. What struck him about these patients when he spoke to them about these sudden deaths, right? And they were often like violent, right? Like that woman whose brother was murdered and so on. But again, they seemed to have no emotion about it, right? They just report it like it's the weather report. So he started to see that rather than go through all the pain and rage and, you know, all the feelings attached both to their relationship throughout life and to the death, they suppressed it and ended up with a physical illness instead, right? So as David Schnarch used to say, you know, many would rather have a pain in the ass than a pain in the heart, right? So we turn an emotional pain into a physical pain, right? Or there's this process of what we call identification, right, with the lost object. So it can also be a way of staying connected, strangely, right? If you ever knew people who, after someone's death, they start to wear the guy's shirt, or they start to talk like them, or
they keep his message on the voicemail.
Exactly, right? It's a refusal, in a sense, right, to accept the loss.
Let go, yeah.
So it does serve a function either to keep the person connected, to deny that loss, or again, we can imagine that if there was a very hostile or ambivalent relationship to the deceased, which is something that predisposes people to pathological mourning, maybe they wish this guy had died a long time ago, right? So in their unconscious mind, when he finally dies, right, they got their wish.
Right.
And it's like, oh shit, on some level, I just killed him, right? I mean, I literally had a patient who, the mother was dying of cancer, and they have these things where you can give more morphine and whatever. And when the mother finally expired, he looked at his wife, he said, did we just kill her?
Oh my God.
Right? But he wanted to kill her. Like he said, yeah, it was like 20 years ago. And I used to joke with her. He said, she would say, don't go to any trouble when I die. He said, don't worry about it. I'll dig a hole in the backyard and throw you in it. And you can see, right, there was an element of truth in that, right? And he then, the tremendous guilt that he actually experienced, which he had no conscious awareness of, it just became symptomatic, right, after her death. Right. But when we uncovered this, right, the massive rage he had toward her, she was a very disturbed and very difficult woman, and how he had wished her dead long ago. And that ever since he got his wish, how he had been punishing himself. Right. It was like, oh, my God, right. Wow. The light bulbs. Right. So there is coherence in the unconscious. So these symptoms or behaviors that people do and don't understand. Often people will come in to my office, they're like, why do I behave this way? They don't understand themselves. They're a mystery, even to them.
So disconnected.
Exactly. And there's as one of my patients said, oh, even though it's difficult to feel this, she said, there's a connectedness in this. Yes, this is familiar. Yes, I know what this is connected to. So that's where you start to get coherence, which is incredibly important for health, well-being.
Coherence, do you mean the unconscious is coherent? Can you
sense?
It makes sense.
It makes sense on some level. So even though on a rational level, right, it seemed to make no sense, or people are confused, they can't make any sense of it. But once we dig in, right, and through the emotion too, right, this really what's happening below the surface on the unconscious level, suddenly it all makes sense. I have these wonderful phrases with patients where the one woman said, oh, it's like a play with a beginning and a middle and an end. Right now, whereas nothing made sense to her when she first came. Like, I don't know why I am there. Right? Or someone else said, oh, it's like all the puzzle pieces or the Lego blocks or, everything.
Coming together. Yeah.
Is so important. Because with our focus on emotion, sometimes people forget, they think it's just about helping people feel and cathartic, but that's a very limited value. Feelings are a means to an end, which is getting to this deeper level which things are going on so that there's a profound understanding of what it is that's actually driving us, what's at the root cause.
But then what happens is that most people, they're smart, they like, yeah, you're right, and then they can't get out, they're in their head because we're so good at doing, and in order to be, it's and so you get them intellectually and they're with you, but then they're still disconnected from their feelings, which is like a whole nother, like I call it like Scrivener will say, Howard will say a neural pathway or neural circuit. And I might say, well, let's go learn this new habit. And it's just not that easy.
Right. But this is why, we've known this for decades, that intellectual insight is rarely sufficient for change. So maybe if you're lucky, 20% of the healthiest patients, right, can use this kind of intellectual insight to make a change, right? So as therapists, we really shouldn't be spending time trying to explain things to people, right, or teach them as, Frida from Reichman said, patients are in need of an experience, not an explanation, right? So we want to help people experience the feelings they've been avoiding. And one of the simplest ways, Rose, is just to encourage people to make a timeline. When did this symptom first show up? What was happening in my life at that time? When did it get better? When did it get worse? Just make that timeline and then start to think about what was going on in your life at that time. And were you really in a place where you were letting yourself feel what you felt about it? Or were you so suddenly your husband leaves you, you've got 4 kids, you've got to get a job. I mean, you didn't have the time or the luxury, right, to be feeling anything. You had to get moving, right? Yeah. So it's that kind of thing, right? That it seems so simple. And yet that alone can have quite a profound impact on starting to make connections that
Excellent insight. Excellent insight.
There's a deep reluctance to actually look inward. Can you talk about that a little bit for people? Because when you do that timeline, there's a sort of a reluctance to actually go there, and I'm not sure how to explore that in the context of that you've held back your feelings, as you say, because you had to deal with the present moment, and now, when 20 years later, they sort of don't want to go back there, and it seems like it's not something that they don't want to do, but they sort of can't do it.
Well, and again, this is where people are going to need help, right? and need a therapist, because of course everybody wants to feel better, right?
That's right.
They have to do what they have to do to get there. I mean, it's the same thing with, somebody's 50 pounds overweight, they're out of shape. I really should go to the gym. I mean, they know what to do. They know what to eat. They just don't do it because in the moment, right, it's easier to, grab a Cheetos or whatever.
It's hard to change, it's hard to change.
It's hard to change, but it's also, right. So that's something that is important to look at. Freud discovered long ago that there was this force, which he called secondary gain, right? So sometimes your problem is actually a solution to a bigger problem. And until you realize that, right, there's no way you're going to let go of it. Now, I remember, again, decades ago, and don't even ask me where I got this idea or why I asked her this question, but this woman, she had had a baby a year before. She had gained 60 pounds when she was pregnant and never lost an ounce of it. And she was complaining, that I need to lose weight and yada, yada, yada. And I don't know why I just said to her, okay, so let's just pretend I have a magic wand and you are now like looking fabulous. You're at your ideal weight. You feel terrific. What's going to happen? She said, oh God, I might have to have sex with my husband again. Okay. So now we have discovered the unconscious again. And this leads into something else that is very important to look at. There is a certain personality configuration that predisposes people to chronic pain. And that is the tendency to be passive, submissive, compliant, to put everyone and everything ahead of yourself. Right? And so this is all part of that if you don't, so if you can't say, no, actually, I'd rather not. You have to say, oh, sweetie, I'd love to, but just can't. I have such a headache. I'd love to go with you, but I just can't. Okay. So this is where, again, you can't just look at the symptom outside of the whole context and the person. So until and unless you can say no, you might need to create, I'm not suggesting this is conscious, intentional, manipulative at all, right? But that your, again, unconscious is trying to help you out here, right? And find a way to get you out of it, right? Without you having to endure whatever.
Use those words. Yeah.
Right, about just saying, no, thanks. I'd rather not.
Yeah.
So,
Well, if you've got a headache, you can't do it, can you? I mean,
I just can't.
you don't have to say no.
So if you can't say, I won't, right, you have to find a way that you can't. Right. So again, the resistance to getting well, right, can be because it's doing something for you. And until you find a healthy alternative for that, you're not going to let it go. Right. So this is where, again, you have to dig a little deeper. But it's funny when you say, well, when people don't want to look inward.
Yes.
Really? You don't want to know you?
I never needed to know me before. Why? Like, I never
Why
needed
now?
to deal with this. This is a biggie. Like, all of a sudden, I got a headache. I got a stomach ache. Like, why now? And then you have to go with, like, wait a minute. Your body doesn't tell you something right away. Like, if you were to listen to the anxiety a month ago, you would have felt it and said, oh, I wonder what's going on. But this is where you have to really, and then it becomes talk therapy, and you get out of the experience because you want to stay in the experience and not be talking. So again, I'm now playing devil's advocate. So wait a minute, why now?
Well, good question. Are you curious about that? Do you want to understand that?
And this is what I want to say this to our listeners, because Dr. Schubiner, who's just a dear, and he's I mean, all the doctors after Sarno passed at a very old age, and are all getting in more into feelings and talking more about this, and it's a much bigger part of their treatment. But Dr. Schubiner will say, well, the fear is worse than even the pain. Like your fear of the pain is worse than the pain. So we're back and talking about, like, we're here and talking about back to resistance, and so we're not even dealing with the pain, we're dealing with the fear of the pain, which is the unconscious fear from, I'm losing my train of thought, so help me here.
Conscious rationalization. So now this is just something I've noticed. So again, I think Schubiner is the greatest thing since sliced bread. So but I have certainly noticed in my training of therapists that doctors have the hardest time giving up the advice giving, right? So he's telling them, and because he's, and they're coming in as the patient, and so he's kind of using the fact that they're compliant and subservient, right, to go along. But I want them to change their whole character. So I tend to ask, don't tell. And that's something I'm constantly reiterating to my trainees. So you want to be a bit Socratic, right? You want to be like the guy in Columbo, if you ever saw that old TV show.
Oh, that's right.
Peter
like House, who knows it all, and just going, huh, really? So it happened that what was that's strange. Okay, so again, I just will ask somebody, right? So is that something you're curious about, right? Do you want to know? And if they say, no, I don't, really? Okay. So that's
a roast to us all the time.
Right. So you'd rather drive blind, and then you're complaining that you keep crashing. I mean, is that kind of inevitable? I mean, so, right. And also people will often complain about their relationships with others. They don't listen to me. Nobody cares about me, blah, blah. Then when I ask, well, what are you feeling? And they avoid it, right? I'll say, who's not listening now? Right? Do you care? Do you give a hoot about what you're feeling or not? Right? And if not, again, it's just like the little kid in the grocery store, right? Who said, Mommy, right? So they're just being quiet, but the mother ignores them. Mommy, right? Mom's still on the phone. Mom, like, what do they have to do to finally get your attention, right? So that's the other thing. It's like, okay, you can keep ignoring yourself, right? And ignoring all these signs, right? But it's no wonder you have a 2x4 over the head, right? So the only question is whether you're going to listen or not, whether you care or not, or curious or not, right? So you can't, in a sense, want them to get better more than they do, right?
Yeah. Well, that's not a what do you call it, a way of healing, is it? When we care more about what them than they care about themselves, they're going to remain passive and they're going to remain unable to self-reflect, aren't they?
Yes.
Because it's the care that would, as you've been speaking, Patricia, would you mind actually exploring a little bit about our childhood experiences and how not being heard is part of the pathology then as an adult? You mentioned it just a moment ago about the child in the supermarket. Right. And, that ignoring of ourselves is more to do with what we learned. It's a learned pattern, isn't it? That if we ignore ourselves, we'll be allowed into the family group or whatever.
I know this is not common knowledge, unfortunately, in our community. But if you look at the research, right, there's nothing even close to a one-to-one relationship between childhood experience and adult psychopathology. So blaming your parents, as I say, by the age of 30, the gig is up. Okay, now in some cases, right, how you deal with you is your responsibility, okay?
Yes.
So in some cases, it's quite clear, right, that they simply are repeating a pattern of self-negation, ignoring, and so on that they had as a child. But even that, this very same person who will say, well, it's because that's the way I was treated. I'll say, yeah, and how were you raised religious? Oh, yeah, really religious. When's the last time you went to church? Oh, years ago. I don't believe that stuff. Okay, so here again is another example, right? It's not about what happened to you. It's about how you deal with your feelings about what happened and what you make it mean.
Beautiful.
So just this past weekend, I went to see the documentary about Anthony Bourdain. Do you know him, the famous chef who wrote Kitchen Confidential? And then here's a guy, he was a line cook, making $800 a week. He was 44 years old. He wrote an article that just for the hell of it, he thought, his mother said, send it to the New Yorker. I mean, nobody's like a line cook in New York. Not only did they accept the article, but within 2 days, he said his entire life changed. He got a book deal. He was on TV. And then he started traveling all over the world, right, going to remote places, having great food, meeting people, and he became super famous. And as he did, he also became increasingly self-destructive, and then he killed himself 3 years ago. And the world was shocked, right? How could this successful guy kill himself? And so the documentary, you see his whole life. His family was extraordinarily loving, supportive. He actually blamed, I don't know why they loved me, but they did. They were extremely supportive. His brother, was totally normal. So it was just another example of, there's nothing even close to a one-to-one relationship. You can have people who had the most privileged upbringings, right? Including, emotional care, right? Who end up going in and out of rehab all their life. And you have people who grew up in the most horrendous circumstances with neglect and abuse, and they are resilient, they're caring, right? So it's just a lot more complicated. And in a way, that's the good news, because there's nothing we can do about what happened to you 30 years ago. But there's a lot we can do to help you deal with your feelings about that, right, in a healthy instead of a destructive way, and to really examine what you are making those memories and stories mean about you, right?
Yes.
So that's the good news. That stuff we can change, right?
Yes, yeah. I'm thinking also, though, of the fact that it's about self-perception about ourselves that we carry. Yeah.
Right.
And as you say about, well, I like to use the Father Christmas thing, oh, so you still believe in Father Christmas, do you? Or Santa Claus? Oh, no. Well, so you still believe that about yourself, do
right.
you?
Right.
Yeah.
Right. And that's a really good point, because, again, just looking at a symptom without understanding it's a person who has this symptom, right, for some reason, right, and that's what we're curious about, right, and how they see themselves is part of that. I mean, you have great examples of people who, maybe they were chubby as a kid, they've been svelte for 30 years, but in their mind they still see themselves as fat.
Yeah.
Right. And then again, our profession can even feed into this. That someone who hasn't had a drink for 40 years is still calling themselves an addict, right? And being supported in that idea, right? Really? So, yeah. So looking at how do you see yourself, right? How do you define yourself, relate to yourself?
How you define yourself is what we're talking about, isn't it, really?
Exactly. Right.
Yeah.
Right. And some people, like you say, they'll create a whole identity around being in pain, right? Or being a patient, or being incapable, or, right? And so even though that creates suffering on some level, right, it's also doing something for the person, even unconsciously, or they wouldn't do it.
Exactly.
Right.
Yes.
Well,
And again,
it's like
think about the
it's like the lies we tell ourselves, says John Fredrickson.
Right, right. And again, if you can't say no, if you can't speak up, right, you're pissed off, right, but you can't say so, and you just become the, proverbial victim, and then try living with somebody like that, right? So it's a way of getting back at other people.
What was amazing that Davanloo did, which was far beyond any other doctor, and yet you see it, like, in Dr. Gabor Mate talks about when the body says no, and then you have Dr. Clark, who's just a delightful friend of ours, and about the gastroenterologist. So, and then you have the soft tissue, So here Davanloo took how the body, because my personal opinion and my experience is autoimmune disease and cancer is also when the body attacks itself. And there's something else going on deep that, it's another show. So here Davanloo took, the things in the brain, the what did he call it, when disassociation, and then the soft tissue, the stomach, and then the muscles. It's fascinating. It's just unbelievable. It makes so much sense. So much sense. And,
right. Yeah. And it's a factor, right? So the danger is we don't want to blame the victim, as it were, right? That they're somehow, creating all.
No one's to blame. Everyone's responsible.
Right. But to say that cancer, I mean, there are a million factors, right? Environmental, like all kinds of things. And the research really doesn't support. I mean, that emotional is a factor and it can give you extended life, but to say that it caused the cancer is really.
No. Let me clear that. Let me clear that on the air. Whatever it is, you're responsible for your experience of it. And usually it's the experience of it that's worse than, like externally it weakened my immune system, but my immune, so I understand. So, but again, no one's to blame. And I have a friend, and we have a client that was on the show who healed herself of cancer. I mean, it was a real scientific story. She healed herself of cancer. The point is, she interviewed a dozen people who healed themselves, and across the board, they all agreed that when they took responsibility,
Cool.
they were able to heal themselves. So this is a biggie.
Mhm.
So that's what I'm saying. And
Right. Yeah, which doesn't mean they caused it in the first place, but they're saying, here it is, and I'm going to take responsibility for it.
I'm going to take control.
I'm not going to use it as an excuse for X, Y, and Z.
No,
and all of that.
everyone's responsible. No, there's never, blame doesn't get us anywhere.
Right, and being a victim, right, is in fact deadly. And there is data to support that, the people who view themselves as a victim of life happens to them. They have no agency. They suffer emotionally, physically, financially, and they have an earlier death, right? And people who have a sense of agency.
Yes.
Right. So, and again, that's not something you can just,
Very good. Here's a question. Rose, can you see the question?
Yes, I can see the question. Yeah.
Is Aura a therapist? Do you know Aura?
No.
Okay.
Okay. Yeah.
And that's a pretty general question. I wonder if you have something a bit more specific that you could ask.
Could you say a word about intergenerational wounds? Thank you. I never heard of that word before I met Rose. Intergenerational trauma. It was something new for me even.
Yeah, I mean, look, it's a passing down, right, of certain ways of, again, dealing with or avoiding, let's say, feelings that even though in the moment are an attempt to protect one, right, from feeling, right, actually create a heck of a lot more trouble down the line. And that gets passed down generation to generation, right? And it's one of the things that's so gratifying. We can also do the opposite when one person changes in the system, right? And then the healing also, right, can go generation to generation. So we all have
you use the example, Patricia, of the person with the headache and the dad dying and she getting the headache. So that's intergenerational, isn't it?
I guess I just don't even think about it that way, as if it's something that's just, passed along with the genes or something. I mean, I'd be curious to find out what that's really about, right? Was it an inability to mourn and staying connected to him? Was it that she had wanted him dead long ago and imagined smashing his head to smithereens? And then when she got her wish, she started doing that to herself. I mean, so again, I guess I'm a little bit allergic to certain terms, or because I think we know what we're referring to. So that's why I asked to be specific. There's a specific incident of something repeating generation to generation. But again, regardless of where it started, right, we're hoping that it's going to stop with you, right? And that's where, again, you're talking about, let's take responsibility for our own experience and what we can do.
Yeah. Patricia, that leads me to another question. And, in my anxieties come into play. The book, what's it called? I've got this one in front of me, Dynamic Psychotherapy, but that's not the one I'm speaking about.
Oh, Lives Transformed, you mean?
Lives Transformed, yes, sorry. Patricia has a beautiful way of teaching us when we're in the seminar room, and that is that in Lives Transformed, what she did in her research is she went back and interviewed the patients 5 years later.
Wow.
And this is in relation to intergenerational trauma. This is why I'm bringing this up, because she observed that not only had the patient changed, but the whole family dynamic has changed, and everyone is much happier. And within that context, Patricia also observes that if, say, for example, within a marriage, if it wasn't working, they were able to split more amicably.
Yeah.
And not only that, they were able to be more united and joined as a family. Would you explore that a little bit more? Because I think that might answer Aura's question.
Yes. I mean, just as one person in a system, whether it's a family or a company, right, can have incredibly damaging impact. One person can also have a profound healing impact.
Yep.
And what I found, and it's nothing I had to encourage people to do or teach them to do. First of all, it's like they're so different in their being, right? People ask them, hey, right? So that's often happens with couples where it's like, hey, I want some of that, you know? So you can see, you can feel it. And I'm thinking of one case, what did we call her? The something self-loathing headmistress. But not only, right, did she sort of end up healing her whole family, but like everybody that she worked with, she was just able to facilitate a process. Like I remember somebody had in her at workspace had died tragically. And so then they were meeting, you know, the next Monday or something. And she just said, you know, she was able to facilitate a process of, you know, think about this person. And, you know, what are you feeling? Right? What is that? And just everybody sort of came together around that. So it really is true that one person can have an enormous impact on everybody around them. And so even though I don't treat families per se, right, I treat it.
But you do.
They end up having, yes, a huge impact. And I've had quite a number of patients, like young women who they're afraid to have children, right, because they somehow haven't worked out, right, their feelings about what happened to them. And that's some of the most wonderful when you come back 5 and 10 years later, and this one woman who she had really been afraid, because talk about intergenerational trauma. There was a huge history of drinking and violence, right, especially the men. So her father was incredibly brutal to her and her older brother especially. And then she found out that his father, her father's father, had actually tried to kill him on 3 different occasions. And she said she had, even before she was even in therapy, she even said to her father, you're doing to us what your father did to you, right? And of course, it only made him more angry. But anyway, because all the men seemed so violent, she was terrified to have children, because what if she had a boy and he ended up being like that, right? But then she ended up marrying this wonderful man. And then at the follow-up, first she had a girl, and then the second one was a boy. And she said, oh, you remember how scared I was, right? Because she said, but he is my sunshine. He's just like his father. He's so sweet, you know. And so she really has created her own family that's very different. And also, interestingly enough, she, because of her love for her mother and her sibling, she was not going to cut her father out of her life. But she really limited. She said, for example, I would never, ever leave my children alone with him. Right. So, I mean, she knows who he is. So she's not going to repeat that, right? There just wasn't a chance in hell that she would ever do something like that. But she also didn't need to, I never want to speak to you again, and that sort of thing. Right. So people are really able to integrate their mixed feelings, right?
This is important.
And, yeah. Because that's become an epidemic. I don't know if you're aware of that, but adult children, and these are children who had no obvious trauma. We're not talking about survivors of physical and sexual abuse, are just cutting off their parents right, left, and sideways, and also, you know, preventing grandparents from seeing grandchildren. So I don't know if it's part of this cancel culture or just like, it's so conflict avoidant. It's like, if something doesn't work, I'm just going to cut you out of my life, right? Instead of dealing with it. And I think that's something, at least, I don't know, in my family, we never had that. So I don't know if it seems like it's something more new, or at least it's becoming epidemic, right? That people think that.
I think under people's anger and not expressing and not understanding themselves, they're just judging and just throwing out opinions, and just, it's like they're just this sort of surface, like, right. I don't like her and I don't like him, and it's
Right.
this, and it's coming from, I mean, it's the deeper thing is what's going on inside of you that you need to, I mean, you're going to be
Right.
a mother-in-law someday, and what are you going to feel like if your daughter-in-law did that? So I think
Right.
it's not being conscious, it's not being conscious. And, you know, we're certain people that come to our show where I always say that you're sensitive and strong, and this is why you're realizing a lot of people don't think about their anxiety, don't think about what's going on in their life but they're not having pain because they're just up here and that works for them.
Mm-hmm.
But you, I, and Rose, we're not, you know, we're sensitive people, you know. That's why we're, you know,
Right.
doing this. And that's why you went into the field, because you were just fascinated by what people are feeling and thinking.
Right.
Indeed. So is there any more questions out there? Because we're going to wrap things up. And I just want to say that I understand you now, Patricia, because you make people laugh. Now you have them secrete endorphins and you get them comfortable with you by these jokes, by this amazing sense of humor.
No, I don't know about that.
It's amazing.
It could be. Actually, no, it could be. Because I remember watching this tape and I was horrified because it was a tape where we had both of us, and usually I'm just have it on the patient, right? But it was on both of us. And again, I was like laughing and joking, and I'm thinking, what the hell am I doing? And like, you know, he really turned on his defenses because I wasn't being heavy-handed about it.
Oh.
I could use humor for him to see how absurd it was, right? And then, believe me, we got very down and dirty after that. But it's interesting to think about, because I was thinking, oh, I shouldn't do that. But I was just.
Listen, you're also learning. It's a journey. You're learning all the time from your students and your clients, I imagine.
Right. And yeah, you want to be flexible, right? And
what do you do when you feel anxiety? What do you do when you feel anxious? How do you take care of yourself?
I don't know. I hate to tell you this, as one of my best friends from graduate school said to me one time, you have the lowest level of ambient anxiety of anybody I know. I'm just not a very anxious person. I would tend more to go to depression and hopelessness, but I'm not really.
But or you get anxious, but you don't judge yourself. You're not being critical. You're just accepting it.
Yeah, I don't know. I just don't get anxious all that often, and if I do, I look into it. So I remember I was going to Norway to do a 2-day workshop, and it was on anxiety, right? And for some reason, I was really anxious about doing this, and I did know why, right? I was able to understand what I was anxious about. And yet just knowing why I was anxious didn't help, which I thought, well, that's really interesting, right? Yeah. And so, but then I thought, how did I get to this? Where, you know, there are these two forces, right? There's wish, desire, like what has us, you know, put on the gas and go forward. We have two nervous systems, right? The approach system and the avoidance system. So when I was feeling this anxiety and I knew what it was about, and I'm even thinking, you know, maybe the plane will crash. I mean, it's one of those things where how do I get out of this? Like, I really don't want to do this. So if you just focus on what you're anxious about and want to avoid, you're going to slam on the brake, right? But then I started to think, now, why in the world am I doing this? Why am I traveling, leaving my nice, cozy home, going all the way to cold, wet Norway and that's what I realized, because I love this stuff and I love sharing with people. So as soon as I got in touch with my desire, then it completely outweighed anxiety. So that might help people, because just focusing on your anxiety and why you're anxious, that's not necessarily going to shift anything. But if you recognize, well, what's the other side of it, right? I'm anxious and I want to avoid this negative consequence, right? But what is it that I really want that I'm going after that's even worth tolerating some anxiety for growth? So,
beautiful.
Yeah, so that's an example.
Lovely. Now, ladies and gentlemen watching us, Patricia has got a YouTube channel
I do.
which you can subscribe to, and be you a therapist or a patient, you'll find it worthwhile. I subscribe to her, and I like to watch Patricia's insights. And I think anyone who has got somatic pain, she may not be speaking about somatic pain, but it refers to somatic pain. In the end, when you become curious about what's happening to you,
Right.
you're going to have to go back to that space to work out how to undo it. So not only has she done that, she's educated us around the world, as she's talked about just going to Norway. And also she's written 4 books. And one of those books, Intensive Short-Term Dynamic Psychotherapy, was one of the early books that I read that made sense for me. Now, there are many other good books out there now, but she's actually got 4. Could you just mention a little bit for any therapists watching, that they could get a good handle on how somatic pain and anxiety and defenses work? And she's got scenarios in the books, so you can actually see verbally how she interacted with the patient. So would you mind, before we finish up, exploring a little bit about that for anyone, therapists that are watching or patients?
So again, there were lots of questions in that question, but I still think the best place to start is with my first book, because to my knowledge, it's the only primer, if you will, on ISTDP, right, where it gives you the theory and the technique from start to finish. So you really get this sort of comprehensive overview of the model. And what I hear over and over again from people, whether it's a civilian, right, who just somehow happened on this book in a bookshop, right, or a professional, is that it's easy to understand. I don't use a lot of jargon. Anybody can understand what I'm talking about, because it's about being human. And the conflicts that we all have between love and loss, and love and hate, and duty and desire, and how we can get ourselves all jammed up, and how to resolve it. So I've gotten letters from people around the world. I remember early on, I got a letter from a man in Switzerland whose wife had become terribly depressed, and he took her to a psychiatrist, and he said, well, she'll have to come 4 or 5 days a week, and maybe after 7 or 8 years, you'll see some improvement. Well, he left that consultation, depressed himself, somehow goes into a bookstore, sees my book, starts reading it, and there's like hope. You mean it's possible for people to get help in a short amount of time? He wrote me a letter, and he said, I know this is, crazy and unlikely, but do you know anybody who's been trained in Switzerland? And I said, you're in luck. Yes, there are several people. And that woman was able to go and get help right in rather than years. So
amazing.
I really recommend, that book. And
Patricia, just hold on a second. Tova, would you write that on the side, please, so that people will know?
So the name of the book?
No.
Intensive Short-Term Dynamic Psychotherapy, Theory and Technique. It says exactly what it is. And I'm currently working on a book on the whole process of working through, right, that whole middle game, right, which has the biggest impact on outcome, and yet it's the least studied. We all know how to get started, and we know what we're looking for at the end, but it's all that stuff in the middle that makes the difference. So that's what I'm working on.
So basically, a client, a patient could read this book and not get lost?
I think so. I mean, I've certainly heard that from lots of people, even though I didn't before the journal.
Okay, wait, intensive short-term dynamic physical therapy, and what was the technique?
Psychotherapy, not physical therapy.
Psychotherapy,
theory and technique.
Theory and technique.
Out of paperback, reasonable price, you can get it. And also, maybe we can give the link to my website, because everything is on there. There are, interviews, and you get links to my,
What is your website, dear? Yeah.
ISTDP Northeast.com. So even though I'm down Southwest,
DP
Northeast.com.
Northeast.com. www.istdp.northeast. No dot.
Just ISTDPNortheast.com.
Beautiful. I'm excited. ISTDP. Very good.
.com. Yes. Well, thank you so much for having me and all you're doing.
Yeah.
People who are suffering with chronic pain.
Wow. Yeah, if you ever get lonely and you feel like you want to talk or make some jokes, you've got an audience with Rose and I, really.
Okay.
I really.
Yeah, I was worried about it. I've never done a live thing like this, so thanks for helping me through.
Oh my God.
Thanks, Patricia.
Yeah, wonderful. Just wonderful. Rose, you have great ideas by finding these amazing people, Rose.
You're a great connector. You're a networker. Yeah, thank you.
Thanks,
good to see you.
Yeah.
Okay.
Okay, so
bye-bye.
bye-bye. God bless
Bye.
everybody. Okay, we're going to go off.